Welcome to Unmasked, the CCI Anesthesia podcast, the show where we dive deep into the world of anesthesia practice improvement, quality enhancement, and the evolving landscape of healthcare. I'm Kieran Zumwalt, your guide on this journey as we explore the strategies, innovations, and stories that shape the future of anesthesia care. Get ready to be enlightened, inspired, and most importantly, unmasked as we unravel the many layers of the current state of anesthesia. This is Unmasked. Hello, and welcome to another episode of Unmasked, the CCI Anesthesia podcast. Today, we're delving deep into the heartbeat of healthcare, anesthesia practice improvement. Our mission is to uncover the strategies, innovations, and trends shaping anesthesia services' future within hospital operations. This episode has a lineup of probing questions designed to unravel the intricacies of anesthesia practice improvement. From enhancing patient safety to leveraging technological advances, we'll explore how hospitals foster collaboration, embrace data-driven decisions, and ensure the overall quality of anesthesia services. I'm your host, Kieran Zumwalt, and together we'll embark on a journey through the vital aspects of anesthesia practice improvement, seeking insights that hospitals can apply to elevate patient care and operational efficiency. Stay tuned for a riveting conversation filled with expert perspectives and actionable strategies. This is Unmasked, the CCI Anesthesia podcast. Today we welcome Bianca Camps, the Executive Vice President of Operations at CCI Anesthesia, to the show. Bianca brings over a decade of experience in strategy, policy, and fostering a culture of quality and efficiency. With a background in emergency medicine and behavioral therapy practice management, her professional affiliations include EDPMA, Lambda Delta Honor Society, and the Women Business Leaders of the U.S. Healthcare Industry Foundation. Bianca, thanks for being here.
Thank you.
Also on the panel, Marguerite Garner is the Associate Vice President of Medical Staff Services and Compliance at CCI Anesthesia, where she strategically leads the Medical Staff Services Department, ensuring provider compliance, managing enrollment processes, and actively contributing to quality improvement and clinical governance. Marguerite, welcome to Unmasked.
Thanks for having me.
So to start, please, if you don't mind, provide us a brief overview of how anesthesia practice improvement initiatives contribute to hospital operations' overall effectiveness and efficiency.
I think when you're working in a hospital, you have so many different departments that you have to work with. You have to work with surgeons, you have to work with leadership, you have to work with staffing, and healthcare has so many different variables, and biggest one is patients, and obviously patients are one of the biggest things that you have to work with as well. I think focusing on practice improvement is key to success. I think that anesthesia is always changing with the types of providers that you're working with. A lot of CRNAs are working now in anesthesia, and I feel like it's a little bit less that physicians are, especially in more rural areas. So I think you have to pay attention to the location that you're working on as well. I mean, it just kind of depends on how the relationship is built, in my opinion. So.
That's correct. The relationship is so crucial, and it's just important that they have that strong relationship, strong operational practices in place to ensure that, the patients are getting the highest quality of care.
Absolutely. And how does quality improvement in anesthesia directly impact patient outcomes and the overall quality of care provided within hospital settings?
Patient outcomes is probably the highest level of importance. You always want to provide high quality, cost-effective healthcare. That is the number one thing. Reducing stays, overnight stays is incredibly important. Reducing opioid usage post-op is incredibly important. Making sure, again, that you have incredibly strong foundational relationships with the surgeons is incredibly important, as a surgeon team is going to make or break an entire OR. And so making sure that the anesthesia team has a good relationship with them, that they have a really great pre-op assessment taken care of. They're asking the right questions about the patients prior to taking them into an OR. Because if you don't know what you're walking into as a clinician, then you can't prepare for any possibilities that could happen when you're in that room. And that's not only with anesthesia, it's with the surgeon, and it's also with the nursing circulator and things like that as well. So I think you have a lot of different areas that you can really kind of hone in on from a quality perspective, and making sure that your patients are taken care of and feel safe and feel protected, and that they get the best quality care that they can have is probably one of the most important thing, in my opinion, too.
Yeah, I concur with that. I know going into new practices, we always want to ask, what is your ERAS protocol, enhanced recovery after surgery, because we want to make sure that we're continuing to provide that high quality care and that patient outcomes are continuing to be positive. That's definitely a big focus for us in our practices, and that collaborative relationship, as you mentioned, with the surgeons and the nurses and circulators and all of that is very important that we establish that early on to positively impact the quality.
Absolutely. And this is something you both have touched on. I want to delve a little bit further into it, is discussing the importance of that collaboration that you mentioned between the anesthesia teams and the other hospital departments, such as surgery, and improving that practice and maintaining high quality care standards. Would you be able to speak a bit more to that?
Yeah, I think, people very rarely consider the administrative team as being incredibly important with this as well. I think if you have the support of an admin team, it really helps guide that collaboration with the surgeon, because we're in partnership. As an anesthesia, practice management company, we are in partnership. We are not the only team. We cannot do anesthesia without having surgeons, right? You can't do anesthesia outside of a hospital or a surgery center or anything like that. But an administrative team really, really impacts that and how things move forward too. So having a strong relationship with your administrative team, with your chief nursing officer, your chief medical officer, the CEO and the COO, it's incredibly important. I think also having great relationships, even through the whole throughput cycle from start to finish, when a patient is recovering, when anesthesia and that team goes in to check on the patient after they've had surgery, you want to make sure that they understand the keys, they understand the questions, that the nursing staff that's with that patient knows indicators that a patient might need some more help, or maybe their pain isn't managed the way it needs to be. And I think, our team is fortunate to have some regional director of operations, and we do have some practice managers and practice administrators that are on site. We have chief, anesthesia providers that are there that are very critical to building and maintaining that really strong collaborative, arrangement between all of the departments. And so you really have to have your finger on the pulse.
And Bianca, can you speak to any of the particulars when you're overseeing any of your practices, how you encourage that kind of collaboration between the departments?
Of course, we always strive to ensure that we are collaborating, communicating as strongly as possible. And by going into our practices, the key to that is having your chief clinician, your chief anesthesia provider. That person really is the key to our success. And with working with the regional director of operations, we can drive change that, maybe administration isn't even aware of, how we can streamline their OR efficiency, how we can just overall improve the practice. That chief anesthesia provider is really just the most pivotal person in that process, in building those relationships with the surgeons, the chief of staff, even the MSO office, even, billing. There's just so many key relationships that they have to be at the forefront of. And that regional director of operation obviously is supporting and facilitating building those relationships. But that's predominantly where we find our most success, is having strong on-site leadership. And the importance of this is just, it goes way beyond managing the practice. It truly impacts the patient and their quality and their experience, with that procedure or at that hospital.
Absolutely. What are some key performance indicators that hospitals need to be focusing on when evaluating performance and quality of anesthesia services, and how can those be effectively measured?
So I can tell you from working in a hospital, there are so many metrics associated with working in hospitals. They can tell you how many minutes you were sitting in one bed before you move into the wheel time, wheel in, wheel out time when a patient goes onto a stretcher, when they get into the OR, how long their timeout was, how long before they actually started the timeout. All of those things are tracked and monitored. And it seems very silly, but it's incredibly important to focus on those, because if you can see an area where you can improve time, if you can see an area where you can improve conversations and, hey guys, can we get this done? Can we do this? when you go into an administrative area, you go to the quality department and you ask them for those numbers, or you speak to your DON, your director of nursing, or your OR director. You can have those conversations and say, hey, we noticed that this surgeon was running late, and that really impacts how everybody is working today. Or, hey, we noticed that this patient was taking a little bit longer to recover from anesthesia, but we found that X, Y, and Z happened, and that's the reason why. So having those indicators, having those metrics, having that data that you can evaluate, dive into, and then come up with an actionable plan is incredibly important. And I just feel like doing root cause analysis, not associated with a bad outcome, is really important. I think a lot of times people believe that doing a root cause analysis is just when something bad happens. But I do think having KPIs that you can focus on helps that too.
Right. That's such a good point. And I mean, those KPIs ensure that we are providing the high quality medicine that we say we're going to provide. And as clinicians, I mean, that's ultimately what they want to do. So having those parameters in place really helps us drive efficiency in the practice as well. I mean, like you were mentioning, the wheels in time, cut time, all these things are important as we're going into new hospitals. We ask these things because, oftentimes we're going in because they're unable to retain staff. Well, perhaps you're unable to retain staff due to the long hours that your providers are working. Oh, well, let's take a look at your OR schedule. Let's take a look at the data to see why everyone is working until 7, 8, sometimes 10 o'clock at night, and then having to turn around and be in the OR again at 7 a.m. We can take a look at that data and kind of help streamline, to see how we can be more efficient.
Patient safety is paramount, as we all know. How can anesthesia practice improvement initiatives enhance patient safety within hospital environments, and what specific strategies have proven successful?
When you can look at a pre-op assessment, and then you can look at how a patient does during the surgery, you can see how they're recovering post-operatively, you can see all of those things. You're never going to be able to guarantee a successful outcome, right? Because the one variable is a patient, but you can always make sure that they're stable, that they're doing what they need to do. I think the number one thing I remember having when I was doing that was, did everybody go home safe today, right? Did everything go perfectly? No. And if it didn't, that's okay, because we have an opportunity to see what happened. Maybe the patient forgot to inform people that they had something to snack on the night before, right? That is a notorious thing. They forget that they're not supposed to eat. They forget they're not supposed to drink, and that directly impacts it.
So how can hospitals leverage technological advances to improve anesthesia practices and ensure the seamless integration of new technologies into patient care workflows?
There's a variety of ways. I feel like as the conversation surrounding the AI and all the things that are essentially going to, I think, take over healthcare, there's just various things I think that we could focus on to streamline the efficiency in the practice.
I can say that one of the things that I've noticed too from a technological perspective is there are still hospitals and surgery centers and locations that use paper charting, right? And that seems very silly in 2024 to still be using paper charting. The amount of time that they save a provider, it's always painful to begin, right? Whenever you go from paper into an electronic record for anesthesia specifically, it's a huge, huge change, and they are adverse to technological changes usually. But I do think that alone has impacted a lot of things in healthcare. When you have that information right at your fingertips, when you can build parameters where you can put in, I guess they're called like warnings, right? Like you have warnings within a system where if a patient, their heart rate is X, Y, and Z, and you put in the record that this is going to happen, there are software systems that can tell you this is not the appropriate level. And that could kind of leverage in with the AI side of it. Medicine should be run by providers, right? It shouldn't really be run by a software system alone, but it's nice to have the support of the technology along with the clinical care that a provider can give as well.
Yeah, that's actually what I was trying to get at as well, is like leveraging technology to help enhance your practice. So those clinical indicators and the warnings that will help drive, hopefully, positive patient outcomes and ensure that, we're not missing anything. At least the clinicians are not missing anything. And then also speaking to just charting in general. Yeah, going from paper charts to electronic charts, for us, that's helpful because we can at least see, okay, what's the productivity levels of our providers as well? How can we improve documentation? These, paper sheets can be kind of hard to track and assess from time to time, but having that electronic system is really going to enhance the delivery of care and improve the practice.
Mm-hmm. With the electronic systems that you mentioned and the constant development of AI that we've been discussing, I want to talk a little bit about training and continuing education and the importance of it. And maybe you can speak a little bit to that.
I think that continuing medical education or continuing education units, so CEUs and CMEs for providers, is important. I know from a quality perspective, there's a lot of information associated with sepsis protocols. There's information associated with hand hygiene compliance. There's information for hospital-acquired infections and things of that nature. And so what you do is you ensure that you find good CMEs, good educational opportunities. You base those based on the areas that you need to improve upon, right? So if you're looking at your KPI, you're looking at your metrics, you're evaluating that, and then you come back the next quarter after you've evaluated an entire quarter and you go, well, we noticed that our infection rate was up here. What was the reason? Then you can tweak what your future education is. I think it's incredibly important to evaluate that, to hone in on areas you need to improve on. I have never really been one to say, we're just going to have this education because I say so. You know what I mean? Like, I feel like if they buy into it, it's a little bit easier. They all have to do hand hygiene protocols. They all have to do appropriate timeouts. They all have to have that training, and it's really important. But I think giving them training that is applicable to what they've been dealing with is probably more important. And I also think that it, again, gets the buy-in from surgeons. It gets the buy-in from administration that you can say, these are all the educational opportunities that we're thinking about, and this is the reason why we're thinking about those. We just wanted to let you know. And the admin team goes, oh, they're really paying attention. They're paying attention to the data, they're paying attention to the information, and we want to make sure that everybody feels like they're moving forward with a strong educational background and training program.
Exactly. And that helps ensure your standardization of the practice as well. Everyone is aware of the training, you're taking attendance, maybe you're even providing food to ensure that everyone shows up. You identify the problem, you set up the training, everyone attends, hopefully, and then you can then go back and measure, your success. And it just ensures that the standardization, in the practice.
Yeah, offering food is always really good.
Oh, yeah, that never hurts.
Yeah, free food gets them in all the time.
Exactly.
That's how we got you guys here today.
Exactly. Exactly.
What are some steps that hospitals can take to stay current with evolving best practices in the field?
I feel like I feel like I'm beating a dead horse, unfortunately, but I think a lot of times evaluating where you need to improve on, right? Mm-hmm. Looking at trends, looking at benchmarking, seeing where you can improve on things. I think that's probably where it's most important, is focusing in on best practices, but your best practices, you have to create those. And usually you don't have to reinvent the wheel. Usually there's other places that have already done it before you. You just have to tweak it based on what applies in your setting. So I do, the best practices that can be created are critical. Streamlining processes, like Bianca mentioned, the ERAS programs, those sorts of things are they're key. They're key, and you can show that things are improving based on best practice.
So how can hospitals effectively utilize data to identify areas for improvement, specifically within anesthesia? And what types of data would be the most valuable for them in order to make those decisions?
Data is everything, I think, when it comes to healthcare and specifically in anesthesia. I mean, we think about the quality data that we collect for all of our sites. I, off the top of my head, can't even think of how many metrics we have, but it's at least 20, right? Due to patient outcomes. So that helps drive patients' experience. And that's so important in anesthesia because it can be a very challenging specialty to navigate so many different types of patients and health history and all of those things. So we find that, that's the most important driver of our success, and it ensures our clinicians are practicing safe medicine, and it does protect them as well.
I think something else too is, the anesthesia department actually has ultimate authority over all anesthetics within a hospital. And a lot of times people tend to forget that anesthesia is utilized in an emergency room, right? They will do hip reductions. They will do, anything with a break. And if a provider is using sedation in an ER, which happens, you want to make sure that your anesthesia department, your anesthesia leadership is evaluating post-care if it was successful, if they followed sedation practices that are very normal, that they're, it's being monitored the right way, that that data and those metrics is actually evaluated. It's one of those things that you don't think about until you have a surveyor show up and they ask you like, oh, how do you guys utilize anesthesia in an emergency department? And someone goes, we use that in the emergency room. That's what we do. But if you're not evaluating that from a quality perspective, then you don't really know what you can improve and you aren't really sure about it. So people don't think about anesthesia outside of an OR all the time, but it is used in other places, and paying attention to quality metrics and data is really important because then you can tie all of those things in together.
So quality, super important, of course. Communication, however, also quite possibly equally as important, especially in a healthcare setting. How can hospitals improve communication and coordination between anesthesia teams, surgical teams, other healthcare providers in order to enhance overall patient care?
You really have to focus and realize that it really is a team effort, right? You don't have one without the other. You cannot have, like I said, you can't have surgery really without anesthesia. You can't provide anesthesia without a circulator in a room to help. You can't put them under without having, pre-op assessments done and all of those things. And so you really, I'm big into huddles. I've always been big into huddles. I know my staff really didn't like having to show up 15 minutes before when I had it. And at the end of the day, I would do assessments too, because I think in the moment when you're paying attention to patients and you're doing what you need to do, I'm not going to say you're on autopilot, but that's your job, right? Like that is very rote. That's what they do every day. It's very comfortable for them. And in the moment, they know how to react. But from a communication perspective, they're always working every day together. But I think if you take the opportunity at the beginning of the day and you take the opportunity at the end of the day and you go, hey, team, I saw this. How can we improve this? I think having that communication really, truly in a whole operational level with the whole team is important. And sometimes you can get that and sometimes you can't, because it is, if you're a hospital, you have shifts. But you can't always tell if there's going to be a motor vehicle accident that shows up, right? So you can try to schedule those things and keep and maintain that open dialogue and that open communication with everybody. But that doesn't mean it's not going to get interrupted with something else that comes in at the same time. So I did that. And I also followed up with a lot of emails, or, I would print things up and put it on walls, be like, hey guys, look at this. So the communication was really, really big. And I think you have to work as a team with that all the time.
Definitely. And I would say, our providers are so busy and checking email isn't at the top of mind, but they text each other, the bulletin board, the huddles, those are so crucial. Just having those touch bases throughout the day really helps streamline the communication and ensure that everyone's working together seamlessly as much as possible.
Absolutely. How does anesthesia practice improvement contribute to both patient and provider satisfaction?
I think that providers don't want to feel like they're wasting their time. So if they feel like they're able to have a voice in how a practice can be improved, and they feel like they have a voice in how their patients can have better outcomes, I think that you get their buy-in, right? And I think that also applies not only with our providers, but the staff as well. And so having that dialogue, having the ability to say, hey, I think we need to fix this, and then everybody going, oh, I mentioned that, or oh, I realized that was a problem 2 weeks ago. Let's focus on this, right? Again, when you're in the moment and you're working on something, you don't always have the time to do a thought back to the day. And so if you just have one person that says, we need to improve this one thing, and other people go, oh yeah. Or to me, the other one is, we did this somewhere else I was at and it worked really well. How can we integrate that here? Can we do something like that where we are now? I think that's, from a practice improvement perspective, and then with patients too, patients and finding out surveys. Not everybody likes doing surveys, but it is important to know, like, how is your pain recovery? How is your recovery pain? Like on a scale of 1 to 10, they'll ask them that, and then you can go, oh, well, maybe we need to work it on that. We need to improve post-operative pain, or we need to improve, pain during the case, like how we're managing it in the middle of the case as well. And that really does help patients and their satisfaction too. Nobody wants to be in pain. That's just how it works.
Yeah. And also, regarding the practice improvements, the steering committees, hospitals
Absolutely.
that build those steering committees to really look at it from a global perspective. How can we improve certain areas of the patient experience, and peer review process? I find I learn a lot when my providers are speaking about, reviewing certain cases, and okay, I've done this procedure here at another site, and this is how we handle it. Just having that collaborative meeting for them to review those cases is really beneficial for the practice and for the patient's outcome.
What strategies can hospitals employ to assess and enhance satisfaction levels continually?
Goodness. I feel like there are so many committees. Bianca actually obviously just touched on them. You have medical executive committees, there's pharmacy and therapeutics committees, there are quality committees, there's morbidity, mortality committees, and all of those things I think kind of help build. Again, I think all of this is like building, right? Building on foundation, building on knowledge, building on, the types of committees you can have, the importance of how everything intermingles with each other. So yeah, I think that probably would help more. That's just how I look at it though. So
Yeah, I would concur. I mean, it's everything could use a committee, but then we also have to be mindful of the time, right, and to work. But having someone to at least be able to identify what needs to be touched on, and maybe it's quarterly, maybe it's annually, but as long as they're having those conversations, hopefully that will drive the change that they're hoping to see.
Anesthesia professionals often face high stress situations. How can hospitals implement initiatives to prevent burnout among anesthesia professionals and ensure their well-being, which would ultimately benefit patient care?
Well, I would say, it starts with going down to the OR. I think it's important for our administrative professionals to actually, suit up, go see what your team is actually doing, talk to them, see what the day-to-day looks like, spend a whole day in the OR. You'll learn a lot, and then be able to see, okay, yeah, they are working a lot. They're not even able to take breaks. That's going to burn them out faster than anything. And there's nothing harder than replacing good quality clinicians. I mean, you can replace them, but the next wave of people will soon be gone as well if you don't fix whatever is broken in your operational process or your block times. If they're working long hours, it's just not sustainable. So just getting into the OR and seeing what they're seeing would be helpful.
And I think making sure that they have a good work-life balance. I think a lot of times, everybody knows that providers in general, they got into it to help people. But there is such a thing as when you're helping people all the time, you sometimes forget to help yourself. And so we had, where I've been in the past, we would have a lot of, availability. We had like a trauma therapist actually at one of the hospitals I was at. And so if there was a really difficult case or a really difficult day, then our providers actually had access to someone that they could talk to in the event that something went bad. Because, over time, things happen, like things happen in life. A case was hard, but it was successful. Sometimes they aren't successful. Sometimes things don't work out the way that you want them to, even though you did everything the right way. And so that really can burn out a provider, along with the long hours, along with just high stress situations. And you really want to make sure that the hospital is aware of cogs and broken things within the wheel that can really start negatively impacting physicians and CRNAs and providers and anybody that's within those rooms.
Mm-hmm. And actually, when you mentioned the trauma therapist, I mean, the mental health obviously is a big topic right now. Everyone is actually focused on it, which is good because it's something that I think has been missing for quite some time. But our clinicians are in these high stress situations, and that's all they see a lot of times, and they never have the opportunity to build relationships with their fellow colleagues in a relaxed manner. So even I love the hospitals that we have that are throwing parties and, getting lunch for the OR as much as they can, because that really ensures that camaraderie amongst the team, because obviously trust is important in situations like this. They can build those relationships, and they also have a moment to have maybe some lighthearted, opportunities or experiences in their place where they work. So it's just important to have that balance and just have a little bit of fun from time to time as well.
Yes, discussing, burnout and everything else, it really just goes to show even further how much feedback is important in establishing feedback loops. So can you speak a little bit about how hospitals can create some effective feedback mechanisms that promote continuous improvement in anesthesia and also continuing to encourage a culture of learning?
I think, again, kind of the whole huddle situation, administrative teams, if you have certain people that, maybe they had a bad couple of weeks, right? They were prickly and they're not routinely like that, right? You can have someone say, hey, we noticed this person is a little bit off. Is something going on, right? I feel like if you have that real-time feedback, or when you notice something is a little bit off, or if they're doing something really well, right? Because feedback doesn't, again, always have to be based on negative situations. Positive feedback is so important as well. If you offer training and they learn something and you see that they're applying what they were trained on, and someone goes, really great job with using that. I know it was a change for you and I really appreciate it. It seems so silly because these are, highly educated individuals, and you would think that they would not need that sort of reassurance, but they're people, right? They're real life human beings that want to know that they're doing well. And even if it seems cheesy, providing feedback is helpful in any situation, but especially when it comes to providers and healthcare and patients too.
Yeah. And to that point, I've actually just been in the physician lounge at some of our locations and just seeing on the bulletin board, the kudos and the high fives to, plethora of start times being within the parameters that the hospital have set in place, and they're congratulating people, and that right there is driving the positive reinforcement that these hospitals want to see towards their metrics. So just even putting it on a bulletin board, I think helps. And then also what you inspect, people will respect. So knowing that these items are being reviewed, and maybe even the clinicians' names, everyone's names are there, and they're able to see, oh, I outperformed whoever, and maybe next month not so much, but that encourages that positive competition, if you will, and ensures that we're getting good patient outcomes.
Engaging anesthesia providers is crucial for successful improvement initiatives. What strategies can hospitals use to involve anesthesia professionals in actively identifying and implementing practice improvements?
I think this actually, the committees, again, I think that involvement in committees is incredibly crucial. Surgical steering committees, OR utilization committees, anesthesia provider committees. I had an advanced practice professional committee where all of our CRNAs, APRNs, and physician's assistants, they came together and they would have a whole list of things that they were dealing with. And they again, you got their buy-in, you got their involvement, you had them feel like they had a voice. In an area where I was located at the time, they didn't necessarily feel like they had a voice because we were trying to transition into more independent practice. And since then, it's changed. But when you're trying to get, to spearhead that change, to have those conversations, I think it's incredibly important. So committees are really important for that involvement, if you have the time. I know a lot of people don't like to do them, but I was always having conversations going, I think you could help with this one a lot. Like, I think you would be really good for this one. And sometimes they were like, yeah. And sometimes they're like, no, we're not going to do that. I don't have the time for that.
So even if they don't have the time for the committees, even the surveys, just sending out a survey, getting some feedback that way. Town halls. It's nice when they have the opportunity, everyone to get together and just ask questions or provide suggestions for improvement. So just having the opportunity for people to relay feedback or relay, things that they're dealing with day to day in the OR, I think is helpful for the hospital.
How can hospitals measure the return on investment in anesthesia practice improvement initiatives?
Well, I mean, I think it doesn't go back to the patient experience. I mean, the return on investment, if you have a good team of anesthesia providers providing good care, your patients are going to come back for their other knee surgery, right? They had a good experience with the first one, and obviously the same surgeon, they enjoyed the surgeon as well, but their recovery time was decreased. They were up and walking in no time. I mean, that's a direct impact to the hospital and a good review for them. So
yeah, I would agree with that. I think, money, you don't like to talk about money with healthcare, right? A return on investment, it sounds very tacky almost, that a patient is associated with the bottom line. But, return on investment is incredibly important, and practice improvement to be able to make sure that you are spending less time in a room and you're recovering faster and that you're getting them under faster. Those sorts of small trims and cutting down those small things can really improve it. I mean, I remember there was a point that it was like $40,000 per minute in one of our ORs. And I'm like, that's insane. That is an insane amount of money. What can we do to trim this fat, essentially? And that really does impact it. That impacts the entire process. And, you need anesthesia. You need to be able to do these cases. But what can we do to make things tightened, but still be safe at the same time?
Alrighty. Well, Bianca, Marguerite, thank you very much for your time today. I really appreciate it. And until next time.
thank you.
Thank you.
Unmasked is brought to you by CCI Anesthesia, leaders in anesthesia services for over 20 years. Subscribe to Unmasked, the CCI Anesthesia podcast today so you never miss an episode. For more resources and information, visit the CCI Anesthesia website at ccianesthesia.com. We look forward to having you with us next time as we continue to unveil the remarkable stories and innovations shaping the future of anesthesia care. Until then, stay curious, stay informed, stay safe, and we'll see you next time.